My name is Abhijit Manhas. I'm a physiotherapist at Back on Track Physiotherapy clinics at Westboro location. Hi everyone. In this video, I'm going to talk about some of the harmful effects of prolonged sitting on the neck and the back, and some simple exercises and stretches that you can do from your desk, which shouldn't take a lot of time, to hopefully prevent some of the negative effects that come out of that prolonged sitting posture. So if you have had any of those neck or low back issues, this is a video for you. So some of the common symptoms that our patients come in with, coming out of this prolonged sitting position, is neck pain. Patients can have neck pain with associated headaches at the end of the day. They come in with neck pain with pain radiating down to their shoulder blade region. So just pain down the shoulder blade, which could also be like a tingling sensation, a burning sensation, or just pain around that area. Some of our patients also come in with pain radiating down the arms or even tingling numbness, sometimes even up till the fingertips. So a lot of these can directly or indirectly be related to the sustained sitting position. And what happens in this position is most of us do not, it's hard, even with our ergonomic setups, it's hard to stay in this upright position and perfect posture while working on our computers. For a lot of us, even with our well-designed ergonomic chairs, what ends up happening is we tend to slouch a little bit and sit back on the chair, and with time, sometimes our bum sliding forward a little bit, and we can get into one of those positions where you really relax and slouch into the chair. Or some of the other positions are maybe you're still sitting upright, but your head kind of rolls forward and your shoulders, from being nice and back into this more rounded shoulder position, and just working in this position for too long can cause a lot of pain or dysfunction. Now what happens in this position is, if we are sitting in this position with our head forward, our head weighs about 5 to 6 kilos. So imagine our head going forward, it puts a lot of strain on the muscles that attach our head to a shoulder blade. So it's almost like these muscles are being stretched for 8+ hours a day with only little breaks in between. So you're in this position, these muscles are under a lot of strain, your shoulders are rounded forward, so there's a lot of like stiffness around the front part of the body, and just a whole lot of stretching and weakness at the back part of the body, and that can lead to all the symptoms that we were talking before, like just neck pain with movements, or pain going down either the arms, the shoulder blades, or headaches. Along with this, sitting can also tighten the hips up, because we're always in that flexed position, so our hips are always bent, right? So that can cause a lot of low back and mid back issues as well. Next, the first stretch would be one for the neck. Because we often find our heads leaning forward, it causes a lot of compression or stress on the muscles at the back of the neck here. So your first exercise is a simple chin tuck, which is basically sitting up nice and tall, and think about the action of tucking your chin in to make a double chin while trying to elongate the back of the neck. So from being in that compressed position to now tucking your chin in and just elongating the back of the neck. I also often call this as a long neck position. So again, so the position is from being in this position to tucking your chin in, making a double chin, and trying to flatten out the back of the neck. I often also give this cue of, think about if your chest was resting on a tabletop. When you perform this exercise, you want to make sure that your chin is not pushing down on the tabletop or lifting up. All it's doing is it's gently just sliding back and forth, and that backward motion actually causes that our neck to go into that elongated neck position. So great exercise. My recommendation would be 10 every hour of chin tucks. The next exercise is a chin tuck, which we already practiced, and now just looking side to side like a shoulder check. So to the side as far as you can, and then the other. While maintaining that chin tucked in, long neck position. So from the side, you want to do it this way, making sure you're not just doing it with your head rolled forward like that. Perfect. Now this is definitely more important for people who have maybe two different screens, or maybe one screen which is kind of turned to the side. So if you find like you always turn to one side when you're working, for example, if my laptop is on the left side and my workstation, and I'm always looking on the left side and I'm working, so chances are that I'm going to tighten up the structures on the left side of my body. So you want to make sure you spend enough time doing rotations on the other side. Try to do both, but if you find that you have a unique setup where you turn to one side more than the other, then just spend some time focusing on moving the other way as well. The next exercise, again always in that chin tucked in, which is your neutral position for the neck, is a chin tucked in and trying to touch your ears to your shoulder on one side as far as you can, and then the other. Again, make sure that you do not do this exercise with your head forward and just turn into the side, but getting into that long neck position and ears to your shoulder on one side and then the other. From the front, it looks like chin tucked in, ears to your shoulder here, and then to the other side and back. Since we also spend a lot of time working on our phones and looking down on the keyboard, we also often lose our ability to look back up or bend our neck backwards, since we're always in that forward position. So another great exercise is to get yourself into that gentle chin tucked in position and then just looking up at the ceiling and doing about 10 repetitions every hour. Our next exercise is to mobilize the shoulder blade region and the shoulders itself. So a simple just shoulder roll or making small circles with your shoulder, trying to get all that motion in your shoulder blade region and trying to feel that shoulder blade kind of move on the rib cage. So again, shrugging the shoulders, pulling them back all the way down, and then making small circles with that. A few repetitions. Now, prolonged sitting often promotes that excessively rounding mid-back, and that excessively rounded mid-back that I have here right now can cause a lot of neck issues, lower back issues, even shoulder issues. So you want to make sure that you try and mobilize your mid-back as often as you can. So one of the stretches that I really like to perform in this position is to try and straighten out the upper back curvature. So from being a convex C to trying to get it a little more straight. It's almost impossible to get it into a concave C in your upper back, but that's fine. We just want to try and get it as straight and get away from this hunched over posture. So the starting position for this is you place both your hands behind your head with your fingers interlocked. You try to stabilize your lower back, and all you're trying to do is look up at the ceiling and try to straighten out the mid back as far as you can go comfortably, and then slowly coming back down to neutral. And again, so not excessively arching from the lower back, just trying to move all the way from the mid back around the shoulder blade region, and then slowly coming back to neutral. So this next exercise really works on your shoulder blade or your mid back upper back region, and it tries to get you away from that C-shaped rounded upper back position that we always find ourselves working on a computer in, and getting into a more straighter and even getting your back into a bit of an extension, and it's a great stretch for your triceps as well. So to execute this exercise, your starting position is going to be sitting at the edge of the chair. I want you to place both your elbows on the table, hands placed slightly behind your head, and then use your legs to push that chair further away from the desk while dropping your chest and your face down towards the floor and This should give you a good stretch at around the mid back and also your tricep area. Now you could either hold this stretch for a few seconds, or you could just go in and out of the stretch. So here and back. So this next exercise is a progression of the exercise that I showed you before. So in this one, you want to place both your hands on the table. You're trying to move that chair away from the table as far as you can, and then you drop your chest down and really try to stretch and elongate your lower back and open the chest area up. Good. And then slowly coming back up. Again, placing both your hands there. You can either hold this position for 5 to 10 seconds, or alternatively, you could also just go back and forth. If the stretch is too aggressive initially, just go back and forth in this position. Another exercise that I really like to perform is the W sitting exercise. So in this exercise, you want to bring your arms to the side of the body so it makes this W, and then to execute this exercise, you're trying to bring both your elbows down and squeezing and pinching your shoulder blades together, and now trying to raise both your hands up, reaching towards the ceiling and trying to stretch your shoulder blades and your arms up as much as you can, and then slowly bringing your arms back down into that position where you're kind of squeezing those shoulder blades together, and repeat again. Stretching out everything on the side here and back. And now moving on to our lower back, the next exercises are basically pelvic tilt exercises. So if you find that after sitting for a couple of hours, you seem to hold more tension around the lower back region, one of the exercises that I love to perform and prescribe to my patients is a pelvic tilt. So basically in this position, you're trying to minimize most of the motion in the neck and the mid back and trying to mobilize only your pelvis and your lower back. So what this looks like is, first off, just trying to flatten the lower back out all the way as much as I can, and then going the other way and trying to arch my lower back as much as I can, and then going back into that straight flattening out position, and then just going back and forth between these two. So that would be a posterior pelvic tilt, and then that's going back into neutral. Just repeat that for about 10 repetitions. And since we spend so much time sitting, we tend to tighten all the muscles and structures present in the front of the hip, and these muscles actually cross the body and go insert in our lower back region. So prolonged sitting, which can cause stiffness of these muscles, can actually cause some mid back issues or lower back issues, as well. And one of the ways to stretch that out is to make sure you get away from this position to really stretching the hips out. What I like to do for this is take a big step forward as if you're about to lunge. So you're trying to stretch the left side here. So big step forward and trying to squeeze the bum muscle on the left side and straighten that out. From the side, it looks like this. So I'm going to take a big step forward while trying to keep my hip straight or extended and my knee straight as well, and then arching from the other side. With this, I could also add this other component of moving my left hand up and across, and then stretching everything from the hip to the side of the torso here. Now again, you could start by, if you're really stiff, you could only do repetitions. So step forward and then move your arms up and across. But if you can tolerate that stretch, then maybe hold that for anywhere between 10 to 30 seconds. Similar on the other side. So if you want to stretch your right side out, you take a big step forward, right? But you try to keep that hip locked out and the knee locked, and then you bring your right arm up and across the body and turn to the side, right? And that should feel like a good stretch in the front of the hip and the side of the torso here. And again, just from the side, big step forward, then bring that arm up and to the side.